Have you been feeling like your energy is low, your motivation just isn't the same, and your libido has taken a hit? You're not alone, and more importantly, you're not broken. As a physician specializing in men's health and hormone optimization, I can tell you this. Your vitality, desire, and sexual performance are not just about aging, they're about imbalances you can correct. In this video, I'll reveal 9 powerful science-backed supplements that may help restore and enhance your libido naturally, without rushing into pharmaceutical medications or synthetic hormones. These are tools I use in clinical practice, supported by peer-reviewed studies and years of patient outcomes. So if you're ready to take back control of your energy, confidence, and performance, watch this video until the end. It might just be the breakthrough you've been waiting for. Let's begin. The first supplement on our list is Maca peruana, or Peruvian maca. This plant is a tuber, much like a potato, native to the high altitudes of the Andes. Traditionally consumed by indigenous Andean populations, maca is now recognized for its adaptogenic properties. It helps the body respond to stress without directly altering hormonal secretion. Several controlled studies have observed its benefits in enhancing sexual desire in both men and women. In clinical research, effective doses of maca generally range from 1.5 to 3 grams daily. However, in my practical experience, doses in the range of 3 to 10 grams per day, ideally split into 2 or 3 doses, often produce more noticeable results. My personal recommendation tends to be approximately 4 grams daily for most individuals. Our second supplement is Panax Ginseng, also known as Korean ginseng. This traditional herb has well-documented vasodilatory properties due to its ability to increase nitric oxide levels, the same mechanism by which medications like tadalafil improve circulation. As a result, Panax Ginseng can enhance genital blood flow, facilitate erections, and offer neuroprotective benefits. The standard dosage in studies is between 200 and 600 milligrams per day. These effects make it a prime candidate not only for boosting libido, but also for improving energy, focus, and overall quality of life. Moving to our third supplement, Ashwagandha, or Withania somnifera, a cornerstone of Ayurvedic medicine. It's classified as an adaptogen and is most effective for stress management. One of its primary mechanisms is reducing excessive cortisol, the body's primary stress hormone. This is particularly important because elevated cortisol indirectly suppresses testosterone production and disrupts hormonal balance. By modulating cortisol, ashwagandha may naturally boost testosterone levels, improve libido, and enhance sleep quality. Some randomized studies even link ashwagandha to reduced anxiety, which is another critical factor in sexual performance. The typical clinical dose lies between 300 to 600 milligrams of a standardized extract, preferably one containing high concentrations of withanolides. The fourth supplement we often overlook, but that is crucial, is zinc. Although technically a mineral, zinc plays a central role in testosterone synthesis, sperm production, and overall sexual function. Men deficient in zinc often report fatigue, weakened immune function, reduced libido, and even hypogonadism. Standard replacement doses range from 15 to 30 milligrams per day. I strongly encourage testing zinc levels before supplementing long-term, but in cases of deficiency, replenishment can have a dramatic positive impact on sexual vitality. Our fifth item is vitamin D, a sexosteroid hormone, not just a vitamin that influences thousands of genes in our body, including the ones related to hormone production. Low levels of vitamin D are commonly found in individuals experiencing fatigue, low mood, and reduced testosterone levels. Despite living in sunny climates, I routinely observe vitamin D deficiencies in clinical practice due to modern indoor lifestyles and inconsistent sun exposure. In terms of dosage, most individuals benefit from 2,000 to 5,000 international units daily. Weekly doses between 50,000 to 100,000 international units under supervision are also effective in certain cases. However, long-term supplementation should be monitored with blood tests every 3 to 4 months. Levels above 60 to 70 ml may increase the risk of calcium buildup in soft tissues. So while vitamin D is essential, excessive intake can be harmful and must be done under professional guidance. Now, let's discuss our sixth supplement, D-aspartic acid. This is a naturally occurring amino acid that plays a key role in the synthesis and release of central hormones, including luteinizing hormone LH and follicle-stimulating hormone FSH, which in turn stimulate testosterone production. D-aspartic acid has shown promise in men with suboptimal testosterone levels, though long-term efficacy is still under investigation. The typical dose is between 2,000 to 3,000 milligrams per day, often taken in cycles to avoid desensitization and maintain effectiveness. Next, we have L-citrulline, another amino acid that serves as a precursor to nitric oxide. Nitric oxide is pivotal for vasodilation, the widening of blood vessels, a process that significantly influences erectile capacity and performance. So, for men dealing with mild erectile dysfunction, particularly when caused by impaired circulation, L-citrulline has demonstrated promising results, especially when combined with other supportive treatments. The usual dosage to enhance sexual function ranges from 3,000 to 6,000 milligrams per day, divided into morning and evening doses to sustain nitric oxide production. Our eighth natural aid is Tribulus terrestris, a plant extract that has become increasingly popular in testosterone-boosting supplements. Some research indicates modest benefits in libido enhancement and possibly even erectile function due to its content of steroidal saponins, particularly protodiosine. However, it's essential that supplementation uses a well-standardized extract containing at least 30 to 40% saponins for effectiveness. Commercially available under names like androstin, Tribulus can be dosed anywhere between 500 to 1,500 milligrams daily. In clinical settings, I often recommend 2,000 to 4,000 milligrams per day, depending on the individual's response and tolerance. Our ninth and final supplement is yohimbine, derived from the bark of the African yohimbe tree. Yohimbine acts primarily on the sympathetic nervous system and can improve penile blood flow by promoting central and peripheral adrenergic stimulation. However, yohimbine must be used with caution, especially in individuals prone to anxiety or palpitations. Side effects such as increased heart rate, restlessness, and insomnia can be problematic. Typical dosage lies between 5 to 10 milligrams daily, but it should always be used under medical supervision, particularly due to its potent pharmacologic effects. To conclude, enhancing libido involves understanding that sexual desire is multifactorial. It's not solely hormonal, nor purely psychological. Libido is influenced by stress levels, sleep quality, physical health, mental well-being, vascular integrity, and the complex interplay of several hormones. As a physician, I emphasize the importance of individualized care. It begins with a comprehensive medical and hormonal evaluation that includes testing parameters such as total and free testosterone, prolactin, FSH, LH, TSH, and vitamin D levels, combined with a deep dive into your lifestyle, sleep hygiene, level of physical activity, nutritional habits, and stress management. One should not attempt to supplement blindly. The real value lies in understanding where the imbalance lies and correcting it with precision. Supplementation should be a targeted, evidence-informed strategy, not a scattershot approach. Remember, your libido is not a random occurrence, and it certainly isn't just about desire. It's a reflection of your physical health, your hormonal balance, your stress levels, your sleep quality, and even your mindset. The supplements we've discussed today are not quick fixes, but they are powerful tools that, when used strategically and under proper guidance, can help reignite your inner vitality and restore the quality of life you deserve. But don't stop here. True transformation comes from knowledge, action, and consistency. So take the next step, get your blood work done, evaluate your lifestyle, and most importantly, speak with a qualified professional. If you found value in this content, hit that like button, subscribe to the channel, and drop your questions in the comments. I respond personally to as many as I can. For deeper insights and personalized content, don't forget to join our members club, where I dive even deeper into topics like testosterone, performance, mental health, and more. Until next time, stay strong, stay focused, and never stop improving. Your best self is just getting started.